So next I'd like to welcome Tiffany to the stage, who will be introducing the next part of our session.
Hello, everyone. Good morning. How's everyone feeling? Good. I hope you're all excited to be here. My name is Tiffany Vassell, and it is my pleasure to introduce Cassandra Mombrun, whose session is titled Standing in Solidarity, the Role and Responsibility of Nursing Leadership During a Time of Crisis. Ms. Mombrun has been a nurse for 16 years, and her experiences encompasses clinical nursing, mentoring, leadership, and advocacy. Cassandra has past experience with nursing leadership, such as her quick ascension to the nurse director of thoracic surgery at the Brigham and Women's Hospital. She has extensive experience working with nursing students, serving as a clinical instructor, mentor, and as faculty in academia. She is currently the vice president for the New England Regional Black Nurses Association and is currently an assistant professor at MGH IHP School of Nursing. Please welcome to the stage Cassandra Mombrun.
Good morning, everybody. I am so happy to be here. And I just want to say thank you to Dr. Canty. That was excellent. I thoroughly enjoyed listening to everything that you had discussed. So today I'm going to talk about, nurses' role and responsibility in the midst of this crisis. And the title is Standing in Solidarity. And I had to reflect on being intentional with using the term solidarity. I wanted to really think about what that meant because I'm a nurse. I've been in nurse leader position before. I've also been a patient. And so when I think about solidarity, to me it's unifying, it's unity, it's being in a mutual agreement that we are all unified for the same cause. And this is so important in the midst of this crisis that we are unified. Oftentimes when you're in the nurse leadership role, sometimes it can really feel like it's us against them, right? The nurses feel that the nurse leaders don't understand them, and nurse leaders can feel that nurses are not quite on the same page as them. And I wanted to be intentional about using that word because it's time for us to really stand in solidarity and shift the conversation to not just talking about our patients, but standing in solidarity with our nurses. So this is just a quick slide. This is imposter syndrome because I want to skip this so fast. But I was intentional about putting this because I am very proud. I have had the privilege of working at world-renowned institutions. I've worked at Boston Children's Hospital. I attended Northeastern University. Currently, I'm the vice president of the New England Regional Black Nurses. Why is this important to say? It's important to say because it's a village. And I'm proud to say that in each institution that I've had the pleasure of working at, you meet people. You meet people who stand in solidarity and support you. And every time you leave with those people and they're behind you. And there's 2 and 3 and 4 and 5. And all of a sudden you have so many people behind you that you realize that when you leave, you're never alone. And I think in the midst of this crisis, we have to understand that we're not alone. It can feel like it's alone because it's a big problem when we look at the numbers, but we are not. So I'm not going to spend too much time because we talked about so many statistics, but obviously we all know where we are at and how Black women are 3 times more likely to die from pregnancy-related cause than white women. And this is just an, infographic at looking at, what the numbers are. And this is kind of dated 2016 to 2018. But here's what I really want to get focused on. So let's talk about nursing, why we're here in the nursing profession. So if you look, we all know that nurses encompass the largest healthcare workforce. There are more nurses than doctors, more nurses than MRI techs, more nurses than radiologists. We are everywhere. So therefore, why can't we fix this problem? We should be able to, right? Wrong. So what I really want to focus on, and I thought about this because it has bothered me as well. If there's so many nurses and you read in all the data, you read in the research articles that nurses, we're here, we can combat health equity. We can combat social determinants of health. We are equipped. But are we? Are we really equipped to combat all these things? And so when I'm thinking about our role and responsibility, the first thing that came to my mind are, where are the gaps? What is missing? If we are with the patient at the bedside for the longest amount of time, we listen to our patients. What is the problem? And one of the things that I have discovered is this. We all know that recently there have been first illustrations of what an actual black woman looks like, the black fetus, the womb, right? And what I thought about is, where are the gaps? And one of the gaps could be in our education. If we think about what are the books teaching our nursing students, what is being put out there? What is the data saying about what we're learning in terms of how to care for our patients? And so when I'm thinking about leadership and influence and support and collaborate, we need to create the spaces for those conversations, because as nurse leaders, we have the power, we are in positions to have those conversations about what are our students learning. We all know that we are in a nursing shortage. We all know the predictions say that the numbers are getting higher and higher of not only nurses leaving the profession, but nurses that we're going to need to care for our loved ones. And so before I start talking about, what's going on around the nation and what the different programs are doing, I wanted to pause to talk about what we think and where we're going and asking questions. Now, I talked about the gap in education that could potentially be there in terms of what are we missing? And one thing I've always found that in this problem, what are our patients saying? The doctors and nurses aren't listening to me. But as leaders, are we listening to our staff? Are we listening to nurses? And I remember a mentor telling me a long time ago that when you're in the room and you're in a meeting and you're listening to what people are saying to you, what you really should be doing is listening to what they're not saying. What is not being said in the conversation? What are we not discussing? We're so busy with trying to check the boxes of filling documentation, of entering, of how many times we have to go in the room, right? For those of you who are still practicing at the bedside, we can only be in the room for a certain amount of time because we have to give medications. Our work is so robotic and prescriptive. We're trying to get numbers checked. As managers and leaders, we're trying to meet those benchmarks, but at the same time, we're not listening to our nurses. Are we really paying attention to what they're not saying and what they're not getting to be able to care for our patients to make sure that they're not missing something? And so, as you all aware up here, you see all the different organizations that I have listed here. So we have the Black Maternal Caucus, Association of Women's Health, AWON, Obstetrics, and the Future of Nursing. And ANA. So I brought up ANA because I don't know if you're familiar with what the ANA has done. The ANA has created the National Commission to Address Racism in Nursing. And during the pandemic in 2020, they released a survey to discuss this. We all knew that racism was alive and well before the pandemic, but we know because of the disproportionate rates of people of color dying from the pandemic, everybody started talking about it. Everybody was in a flurry to discuss this. And so the National Commission to Address Racism was formed by a few of those nursing organizations, National Black Nurses Association, National Association of Hispanic Nurses, et cetera, to really talk about discussion of how racism impacts nursing. And the survey results were pretty, not surprising to me, but they were surprising at the high numbers. So one of the survey results showed that 93%, by the way, the survey was completed by 5,623 nurses across the United States. And out of those 5,623 nurses, 93% experienced racism in the workplace. And that 93% represented black nurses. And of that 93%, 70% of leaders did nothing about it. And so if our nurses are experiencing it at the nurse level, imagine what it's like for our patients. And so the commission is working very hard to address these issues, very hard to try to see how we can come together. And it made me very sad. It made me very sad because I've experienced racism myself in my career, but it made me sad because if 93% of black nurses have experienced it, then our patients definitely have experienced it as well. And so since there's a flurry of conversation and talking about this, what I am happy to see is in 2 weeks, the ANA Massachusetts is going to have a summit. It's going to be on Friday, and they're going to discuss racism in nursing. And how does this intertwine with the Black maternal health crisis? As you've heard already before, that our patients are experiencing this at the bedside. And so they're coming together with important stakeholders across the Commonwealth to discuss this issue and talk about solutions that can push us forward. The Future of Nursing report. So the Future of Nursing report has recommendations. There's about 9 recommendations, and there's one recommendation that I thought was interesting. Sorry, my slides are out of order. Recommendation number 7. Recommendation number 7 discusses that nursing education programs, accreditors, and the National Council of State Boards of Nursing should ensure that nurses are prepared to address social determinants of health and achieve health equity. And so this is from 2020 to 2030. We are in 2023. So if this is what our future is, then what is our present? If they're predicting this in 2030, then where are we at now? And do we feel good about where we are at now? And I do believe that it starts with nursing education really to combat this issue, because if we're supposed to achieve that, we're in 2023, so in 7 years, we have 7 years. We have 7 years to achieve this. Now, I don't know if you know about how long it takes to publish nursing textbooks. It's a very long process. And so what's happening is we're in a flurry. We have our books, but then we're using everything else to supplement, to give our students, to try to paint the big picture. But why can't we have that in our books, right? We have to start with our books, and we have to start looking at our publishers, not only our publishers, but our reviewers. It came across to me one day that I had been asked to review a book, a nursing textbook. And I was looking at the textbook and I was looking to see what they had in terms of information about statistics that concern people of color. And what I saw in the textbook, I won't name the book or the publisher, was that there were statistics. And there were statistics that said, 93% of African Americans have higher risk for blood pressure. 87% of African Americans have higher risk for clots and strokes. But what was missing in some of what I researched was there was not any contextualization behind it. There was no conversation about social determinants of health. It was a blanket statement with statistics that is dangerous for our students, because our students are now walking out saying, well, she's an African American 38-year-old woman. Of course she has high blood pressure. But what's behind it? Now, these textbooks have rich information, and I'm not taking away from what they have. But there's a big missing piece that could be harming our future nurses. And remember, our future nurses, I'm learning all about Gen Z. And I was biased. I thought we were in trouble. But we're not. We're not in trouble with Gen Z. I'm beginning to really enjoy being around Gen Z, because Gen Z says what I'm not going to do is read this book. Because this book has a lot in it that the math isn't mathing. And as being a professor and working with Gen Z can really take you down. Sometimes I leave feeling like maybe I picked the wrong profession, because Gen Z will also tell you about yourself. and give you unsolicited advice about what you should do and not do. But it's inspired me because the future of nursing, when I read this on my own, I was disappointed because I said, we have 7 years to get this right. But when I'm around Gen Z lets me know, oh, professor, I'm not reading that book. I found this. And so I'm looking at this, and I'm looking at what they're showing me in their phones and laptops, and I'm like, this is legit. Where did you find this article? Right? And so Gen Z has given me a different purpose because as much as I was disappointed and really sad, I said to myself, they've got something here because they're challenging the status quo. So while maybe this 7 years, I feel inspired that we're going to get somewhere because we have a generation that is not going to just accept what is given to them. And so as I spend hours preparing a syllabus with books that I've researched, I'd say half of them have said, I didn't buy the book. Okay. All right. You do realize 90% of the questions come from the book, but okay. All right. And so, the research priorities for the future of nursing look at addressing health equity in the nursing workforce. And again, as you know, we're trying to, diversify the nursing workforce, but representation matters. Representation matters in all aspects, and it's crucial with the Black maternal health crisis. And so let's talk about the National Black Nurses Association. I'm not sure if you're familiar with the National Black Nurses Association. But the National Black Nurses Association represents 200,000 nurses all over the nation. And there's 111 chapters. And I represent New England Regional Black Nurses Association. Why am I mentioning this? Well, the National Black Nurses Association calls upon the 118th Congress with recommendations. So every year there's National Black Nurses Day on Capitol Hill, where members from all over the 111 chartered organizations come together and they go to Capitol Hill and they go to discuss issues that are important in the African American community. And Black maternal health is one of them. And so they want support legislation that will provide key investments in social determinants to save moms and end disparities, as well as reintroducing doula-related legislation to provide access to doula care and birth support. Right? And so every year, constituents from NBNA go to Capitol Hill Day in February to represent these issues. But let's talk about what's happening locally. So I don't know, again, if you're familiar with the New England Regional Black Nurses Association, but we are a nonprofit organization that serves the community of Boston and beyond. NERBNA has a very special place to my heart. NERBNA has just celebrated 50 years of being an organization. We had a wonderful event in September celebrating this 50 years. We've collaborated with stakeholders all over. We've worked with All of Us Research, and NERBNA also had the privilege of collaborating with Organization of Nurse Leaders to create the Nurses Pledge. The Nurses Pledge was created shortly after the death of George Floyd, where the leaders of Organization of Nurse Leaders wanted to do something. They wanted to say something, but they didn't know how. They didn't know how, as being a predominantly white organization, to come up with a statement to stand in solidarity. And that is why it's really important for us to stand in solidarity to combat these issues. So they came to NERBNA Board of Directors to say, how can we do this? And we created the Nurses Pledge to champion diversity, equity, and inclusion. And that has been so monumentous for our organization as well. Because of this, we've had over 5,000 signatures, and we've had other states reach out to us to talk about how this came to be, incorporating diversity, equity, inclusion in their systems. The Iowa Health organization had reached out for us to discuss this. And why am I mentioning this? I'm mentioning this because you plant the seed and people come. And we've had people all over wanting to know more about this. But what's more important is the conversation about health equity happening at hospitals where our very patients are dying. And that means more than anything. And even if we don't get to save everybody, but the fact that that conversation is being had is going to save more lives. And so NERBNA is proud to collaborate with stakeholders. We've collaborated with Alzheimer's Brain Health. Our board of directors talented group of nurses that hold different prominent positions across the Commonwealth. And why am I saying this? Because it's about who you know, right? And so we have so many people on our board and in our membership that are working all over the hospitals in Massachusetts that can do something about it, that can collaborate with your programs, that can give information to the community. We serve the community. We run blood pressure clinics. We go to schools. We talk about the workforce. We do so many things. And so I want to leave you with a quote and a couple of pearls. A leader sees greatness in other people. He nor she can be much of a leader if all she sees is herself. And one thing we have to do, our responsibility as leaders, is to invigorate and motivate our nurses. We have the responsibility to mentor our nurses, equip them with the tools for success, listen and pay attention to what they're not saying, because it's in what they're not saying is what is missing. Encourage them to grow, encourage them to gain knowledge, continue the conversation. And for all of the leaders that are in the room, when you're with your staff and your nurses, talk less, lean in, listen more, listen to what they need to take care of their patients. Listen to what they're not saying to help you have a better sense of what they need, especially those in the maternal spaces, those that are in L&D, those that are in those spaces that would help combat this issue and provide measurable outcomes. Discuss with your leadership staff what you're looking for. Yes, we have a long way to go, but I really do believe that if we cultivate our staff early on and understand their needs and get to their level, we can definitely prepare them to be a stronger workforce and save more lives. Thank you.